to the cloud, since I don't know how big this is going to be. All right. Okay, I'll go ahead and get started. So this is the coach safety training for North Lake Little League, and this is my first shot at this. And thanks to DJ, these slides are all DJ's slides, and I've done some editing, but thanks to him, he's the author of all this, and it's great. Thank you for sharing that. So the agenda tonight is going to be, we'll first cover some preseason planning, some stuff for administration, and I'll go over the policies and prevention measures for some different topics. We'll cover COVID, which is thankfully very short this year now, and the equipment in the fields, and some practice game and weather considerations for safety. And then I will turn the second half, or it might be a little more than half, depends on how much we talk. DJ will cover first aid and first aid topics and injuries and prevention of injuries. And I know, oh, somebody's asking to be admitted. There you go. So I'll go ahead and get started, go to the presentation. So when we're talking about safety, we can think of it in a lot of different ways. And one of the ways to think about it is your whole team. And to get your whole team involved, one of the recommendations that we have is to have a team safety officer. And I serve as my team safety officer. I'm the safety officer of the league, and I took over just this year for DJ, who's been doing it for several years. And to have one of the things that we also provide that we're doing tonight is safety training. As a manager, what you need to think about are early in the season, hopefully, and hopefully someone's been in contact with some of your coaches and assistants. If they haven't, then you should contact the president or a vice president of your league for making sure that you got background checks on everybody who is participating, including yourselves and your coaches and all your assistants. And then from the families, you need to be sure that you have your team forms. Hopefully everybody's got their medical releases forms in, and that tells us things like, what they might be allergic to. It also allows the coaches to contact medical care if needed, and parent contacts on there. And there should also be a concussion information sheet that you have. And everybody should have read that they acknowledge that information, that they sign that, and you should have a copy of that. And then coaches also should have a way to, we have a form that allows you to track injuries and prevent and incidents, sorry. And if you have any questions about injuries or incidents, you can certainly contact me. There's some contact information in a couple slides, or anyone on the board can direct that information to me. Here's the voluntary application form, and then the medical release form that we're using. Hopefully those look familiar to you. So here's some contact information for myself, and I prefer my phone. And that, if you want to take a picture of that, and you can call me whenever you need to. And there's the president and the fields person as well, Richard Grant. So I'm going to jump into COVID safety right now. So for managers' responsibilities, those have been much reduced this year, which is a great relief for many of us. But and some of these things are not even requirements now, but we recommend strongly recommend that in the case of when you have practices and events, the games and practices, that you know who was at those events. And so I just do it through my TeamSnap app, where I always keep a current list of who attended, even if it wasn't correct at the beginning of the practice. At the end of practice, I make sure I update that. Just keep that there. And then we make sure that we communicate with parents, and they should already know this when registration, they had to attest to this, that they would follow the policies for COVID, which required that players stay home if they test positive, and that we follow the current guidelines for that. I'll talk about those current guidelines in just a minute. And we also recommend, it's not required, of course, but we recommend if kids are feeling ill or if they've known close contact with a COVID positive person, they have to use their own judgment on that. How much close contact did they have, and do they feel that their kid is at risk of getting sick or making others sick? There are no additional mask or tracing policies at this time that we have to follow. Everybody's able to make their own decision on masks at this time for outdoors. And I think a couple days we can do indoors as well with no masks. But managers do have to be ready this year in case those things change. It could, we've seen them change before, and it's possible that will happen, and then managers will have to adapt to that during the season. So if it's important it is important for us to maintain our COVID policies, and that means stay home if you're sick, or if you test positive for COVID-19. And that you've probably seen these symptoms all over the place for the COVID symptoms. Of course, the fever is one of the things we look for first. And this applies to all the athletes and the coaches and the umpires and spectators. We ask that everybody follow these policies, that if you do test positive for COVID, that you stay home for 5 days. You isolate for 5 days. If there's no symptoms after 5 days, then you can come back and play, but a mask should be worn for 5 more days, for 10 total days. If the symptoms persist after 5 days, we ask that you still stay home until there's no fever or symptoms. So remain vigilant to that. And if those guidances change with local and state health agencies, then we'll have to be flexible with that. So King County right now, those are the policies, and no masks are required outdoors right now. So of course, I think most of the kids on my team still wear them. I noticed the kids are more comfortable wearing these than adults. So I see a lot of my kids wear them to practice, and that's great. I really try to wear it myself if we're in close contacts, if we're having a close meeting. But again, I'll talk a little bit about some safety things. And one of those things that we do is try not to have close contacts. We try to spread out. So that's the first bullet point here, really, is to plan your practices considering that you want to have some distancing. I'm sure everybody's probably already doing this. It's something that we all learned over the past couple of years. And reduce or eliminate your sharing of equipment. Disinfect it when necessary to share it. And that's especially for things like masks that go over faces. We have disinfectant, and I think many of you got it, but I don't know if you all got it. And so if you did not get it, please contact me. I can get you some disinfectant if you want to. I have some. I bought some wipes for myself that I have that I put in my bag, and I can wipe my masks. And then, always encourage your players to space out when they're in the dugouts. Try not to keep them too packed together, and don't share things you're drinking or eating. Try to avoid that. And again, we're going to have to be flexible if things change. So for the equipment, I already touched on that a little bit, but I think last year this rule was written as they must have their own equipment, and I think most people do. And the only time I have sharing of equipment is when somebody's forgotten something. Sometimes that does happen, right? Sometimes we forget something, or, there's a catcher's mask. Probably the catcher's masks are the things that end up getting shared the most, because there's kind of limited supply of those. And those can be shared, but they should be wiped down before you share them between kids. The players are not required to wear face masks, but again, if the family decides to do it and they prefer to have their children, of course, support that and support their decisions. And hopefully the other kids are also helpful in supporting that decision, keeping the kids safe. So again, we have some of this. If you must share equipment, we have some of this disinfectant that I've prepared, and I think everybody got it, but I'm not sure if everybody's bag has it. If you don't have any disinfectant, and we have some that it's a disinfectant. I'm forgetting the name now, DJ, but you have to dilute it, and the dilution instructions are on the little container that you receive. So it has to be diluted with water before use. So this is shifting over to the manager's responsibilities generally for equipment safety. So we're shifting gears here now away from COVID. And it's your responsibility as a team manager to ensure that your team is compliant with Little League baseball and softball regulations. That's true really across all the regulations. And there's a lot. And I can't possibly cover them all, and we can't in this time frame. So at the bottom of this slide, you'll see there's a link to the Little League rules, and you can certainly look at that. I encourage you to. Another thing that I really encourage, that I love, actually, I just put that app, the Little League Rulebook app, on my phone. It costs $1.99, and there's baseball, softball, all the 2022 rules. Broken down into the categories, and it's a lot of reading, but you can find everything you want. They're searchable, and it's nice. So you can buy the paper copy too, I believe, on that website. I think it's $4.99. So be sure that you're doing your inspections of your equipment to make sure that they've got that they're certified by the appropriate certification. I think in USA Baseball and USSSA softball. Of course, look for any of your equipment that's been modified, like home modified in some way, has been altered from the manufacturer's original form. It probably could be problematic. So look for those things, and for helmets too as well. Sometimes people put things on their helmets that are really not safe or not legal, and umpires will call you on that. So again, the softball, the bats, we list some of the sizes that are permitted, and the I can't remember what BPF is. It's a factor that 1.2 is something like 1.2 times the ricochet that you get off of a concrete wall or something like that. It's a amplification of your hit, basically, and it only can be allowed up to 1.2 on softball bats. On your equipment safety, again, on your bats, just physically inspect them. Look for cracks and dents, and don't use those bats. And for helmets, make sure that they also have a certification sticker on them, and they're not cracked. One of the things that happens a lot of times towards the end of the season, you get some of the padding that's falling off, or kids might have taped them on there, and that's needs to be that needs to be either replaced, or the whole helmet might need to be replaced. Sometimes the padding is kind of ripped and difficult to replace if it's part of the helmet. And you can't have any stickers. There's a picture here of a little kid with some stickers on his helmet, and I think umpires will tell you can't use that. And attachments we're talking about the things that go across the face, or the shield, the full shield, like most of the softballers have. Has to be manufactured, put on there by the manufacturer or approved. And probably your umpire will have to take a look at it if it's something that you're concerned about. For catcher's gear, remember that must be worn anytime the player's catching. So if you're catching a ball in practice or warm-ups or the game. And then don't forget about when the catcher's doing something like catching infield for a coach who's hitting, they need to have that head protection on there because you're swinging a bat. And so you need to be sure that your catcher is padded up. And you need to have on the catcher's gear, make sure the face mask has that throat guard. We got called on that once last year, and I don't know how I missed it, but it just wasn't there. And the umpire pointed it out and had to put one on. For boys, the catcher is required to have a protective cup, and for infielders, it's encouraged. No jewelry. They will allow no jewelry this year. Not even the little rubber wristband things that people get sometimes for different causes. They won't allow those. This year is what the rules said. So I don't know how flexible it'll be, but anyway, if you have any jewelry on your kids, on their wrists or on their necks, make sure that it's off. Even some umpires have been talking about some of the things that girls wear to pull back their hair. That's okay to wear those things, but they really can't have hard things, hard pieces or sharp pieces that could, when if the ball were to hit them, it would push into their head. So you have to be careful about that. And safety glasses are encouraged. I haven't had kids wear safety glasses yet, but that's on here. I don't know. I haven't seen that one. So thanks for that information, DJ. Before you use fields, anytime before practices or games, do a good job of checking those out. I'm sure you do, and you know that if you've coached, that these fields are in all sorts of different conditions. They're not all like North Creek perfect fields. A lot of them have holes and rocks, and so it's a good idea to put a rake in your, if you can fit a rake in your vehicle. It's good because sometimes they're hard to find at those fields. I've noticed. I mean, they should be in the little shacks at the field, but sometimes they're hard to find, or they walk away somehow. But so I do try to remember to bring a rake, a small rake, at least to cover up holes, and sometimes you have big wet areas. And then pick up all the trash and anything that's unsafe, especially around the fencing, where kids could run into it. Look at those areas, and bases. The bases have to be sure. So we're going to have volunteers putting our bases in, and it's important that those people are trained, and then also that you look at those bases so they're not coming out, or so kids aren't tripping over them. They're not. Probably coming out is better than being in there incorrectly and having somebody tripping over it. Oh, sorry. So some of the softball, baseball safety, some of the injuries that occur most frequently, they occur more frequently in games than in practices, and more frequently in the infield, less commonly in the outfield. Bats and balls hitting body parts are largely the injuries that are occurring. And what you see are bruises, abrasions, nosebleeds. Those are the main things. And again, DJ is going to talk about the first aid for these. Thankfully, we have somebody like DJ who's a real expert on treating wounds. And you may see some fractures and some concussions. Hopefully, that's very minimal. Hopefully, you don't see that. And especially for baseball, some of the overuse injuries for pitchers, not as much of an issue for softball players, but of course, we softball players also throw overhand. So we have some of those issues. We have to make sure that we're getting our kids ready for the practices and for the games by warming up. So that's the first bullet point. Next time is warm up and stretch. Don't skimp on that. And I know it's really, really hard to not sometimes because you've got a limited amount of time, but it's so worth it to just say, okay, we're setting apart this 15 minutes. It doesn't matter if you're 15 minutes late, you still have to do this 15 minutes of warm up and stretching. And then if you make that happen, many times what happens is the people who are late will come up on time because they don't want to do the stretching and warm up by themselves. But it's good to stick to that. Make sure that the helmets and the face mask and the fielders masks, that the kids know that those are available, that they need to, when they need to wear those. For softball, the fielders masks are required for pitchers, and then the infielders, I like to have those infielders have my fielders masks, especially at the younger ages. Now that I'm coaching majors this year, and a lot of the kids want to take those off, and I think a lot of kids will get away with being okay to do that because they've learned, you know, how to protect their bodies. But there's some of them who haven't, and they still want to take off the mask. And so I'm just requiring that for the first part of the season, at least, that they all have to wear them on the infield. You don't have to, that's not a requirement, but I am. And gives some kids who are newer to the game some time to get used to that with the mask on. And then we'll see later, they may have to keep it on if it seems like they're still needing that. I think it's a very important part of the game to get your face protected when you're fielding. So arm health and safety, again, DJ is going to talk about that. It's important to work on sliding, because one of the things about sliding, not just to make you become safe sometimes, but for safety, right? Because you don't want to have that collision, and instead of having a collision at home plate, let's slide and be safe. And probably be safe in more than one way. Be safe called by the umpire, and safety, not running into someone. And also talk about the obstruction rules and how players should be positioned, because that helps a lot in avoiding collisions, right? We all have seen that happen a lot. Somebody's standing in the right place. We were just practicing that the other day. We got majors who've seen this a lot, but they still need to hear it every year. Standing in the right place. Don't put that foot right in front of the bag, because that's where the runner's running. Those kinds of things. Continuously teach that. So to do some prevention, again, DJ is going to talk about specific prevention measures. This is in general conditioning, like I talked about before, games and practices, teach the skills. And when they do the skill correctly, that is helpful in preventing injuries. And follow the safety guidelines, including wearing your protective gear, like the catcher's gear, your helmets, face fielders masks. I include sleeves on there because sometimes we're out there and it's cold and kids are out there throwing the ball hard, before they're really warmed up, with no warmth on their arms. So every time we walk out the door, I'm reminding my daughter, do you have sleeves on today? It's only 40 degrees outside. It's not warm. So I remember sleeves as much as I can to keep their arms a little bit warmer, and keep them hydrated. Of course, we take frequent every time. Okay, you're going to go bat, make sure you get something to drink. You're going to be on deck, get something to drink before you get in there. And give them some days to rest and recover. They can't play every day. Some of these kids who are on select and little league, they end up playing a lot, right? And give them some days to rest. They just need days off. They can't play baseball and softball every day. Yep. And don't forget those warm-up activities every time you play. So some of the warm-ups that, and again, I really recommend you make them structured, you make them standard, and the kids just expect, here's what we do every day. And this takes 15 to 20 minutes. And here we're gonna do our stretching. We're gonna do some aerobics. We're gonna do some movements, some dynamic movements. There's some example along the right here, and that's a great set of, if you did all of those and consciously did all those, that would probably take you about 15 minutes. And those are basically what you're covering. There's a video link down there, and you can find those all over YouTube that also goes, if you look at all of them, they all go through the basic first warm up, then some arms, then some neck and shoulders, then some arm stretches, then some legs and hamstring stretching. So going all the way down this list, pretty much you'll find that on videos but take the time. And I think it really helps for the kids to just see it pretty much the same every time. Of course, it's good to mix it up a little bit, but hitting all the areas is important. And so keeping it kind of roughly the same every time is good. At least I've noticed kids start doing it themselves before coach even tells them to start doing it. So if you're in batting cages, we're going to shift to batting cages. I actually just had my team in before this presentation. We were in batting cages over EL1, and yeah, be sure you always have a coach in there. And I keep parents on the outside who are also watching the kids, making sure that they are outside the cages when they're not batting. Sometimes we do put multiple kids in there, but we always have 2 or 3 coaches in there with them, and they might be working on just hitting off a tee into the net. And so these are structured sessions. So each kid is doing a specific hitting drill, or sometimes we do pitching in there. And I also do recruit facilitators. So parents are helping to keep the kids organized. And when you're outside the cages, don't have the bats swinging around. Wait till you're inside the cage and everybody's got their helmets on. Kids are well spaced, and then they can swing. Again, only use your league-approved equipment. Make sure that you're not using the other secondhand stuff that somebody might have bought or found at the batting cage. Just use the stuff that you've inspected. And sometimes you put a catcher in there. Make sure that they're in full gear inside the batting cage if they're catching, if you're doing some live pitching. Sometimes it's you want to just put a catcher in there quickly, but you got to be sure that they're fully geared up. Okay. So at practices and games, yes, no alcohol or tobacco. Keep those at your home, I guess, and keep those away from the games and practices. When you have practices, of course, we have them structured and supervised. All the drills, they're always a parent or a coach there. The coaches are not supposed to warm up pitchers at games. I catch my pitchers at practices, but I don't. We can't do that at games. And I always put masks on too, because I don't want. I've been hit before. I learned my lesson once when my daughter hit me in the face. I thought she's just 10 years old. She's not throwing very hard yet, but even not a very hard throw hurts when you get hit in the face. So make sure that, if you are coaching, if you are catching at practices, you get some protection too as a coach. And again, already hit this topic many times, have structured warm-ups. In the dugouts, make sure you have a bench control. So there's a coach that's assigned to the bench, and keep it orderly. Tell the players, what do you expect? Okay, is everybody thinking about the next inning? There's 2 outs. Everybody's got to know where your glove is. There's somebody in there to help them keep orderly and in their batting order. And don't let them carry bats in the dugout. Don't let them have their bats. Really, their bats are only to be held when they're outside the dugout or carried outside the dugout. And then they can swing when they're allowed to. We can't have them on deck. They don't discourage that in Little League, to have kids swinging on deck. So we have to swing before the game when practicing, and then during the game. They can't swing before they're up to bat. Keep all the gates closed. Keep the players away from them because those gates are heavy. Again, there's no on-deck batters and no sliding back head first. Well, no, I'm sorry, only when you're coming back to the base. No sliding head first when you're going from first to second or second to third, third to home. We have to do feet first sliding. It's not allowed. I think in the older ages, they might allow it to start happening in juniors, I think. But until then, you can only do feet first sliding. And avoid collisions. Again, we talked a little bit about that, positioning of fielders and knowing how to run the bases and knowing when you need to slide to avoid contact. So as managers, you're responsible for all the kids from the time they get there until their parents pick them up. Don't leave the field when there's a kid there by himself. You can never do that. Even if the parent says I'm coming, you just wait for the parent. You really cannot leave a kid, and you just should not leave them unsupervised until there's a parent there to pick them up. If they have to run off to the bathroom, you should send more than one, or send them with a parent or somebody that can be trusted, part of the family. The other thing about if you have to transport kids, always remember that you shouldn't be alone with another kid on your team. Of course it can be your own kid, but you as a coach should not just go pick up one kid and bring them. Should have more. You could pick up members of a team, but it shouldn't just be one kid. It could be your child and another child, or two or three, but you can't have just one. Shouldn't do that. So then the last thing that I have to talk about are some weather considerations. Don't forget that we have a lot of cool, cold weather, and always have to remind parents, I have to remind my own daughter to dress properly. 50s and 60s is nice. Actually, sometimes it's 40s and drizzle. And that's where you really need to keep them warm and keep their bodies warm so they're not hurting their muscles when they're out there when they're so cold and slipping. We hopefully we have some good shoes. Susceptible to hypothermia. So especially if you're got a kid who's working hard and they're sweating a little bit, and they sit in the dugout and it's windy and they're sweaty, and they don't have enough protection on, they can get cold. So make sure they've got some layers with them. So encourage your parents to have some layers in their bags. And then hydration. When it gets hotter, be sure you keep an eye on their hydration. You have to be sure they're drinking. Sometimes they'll just go talk with their friends and you have to say, drink. Everybody, make sure you're getting a drink. And take some breaks and watch out for not just your team, right? Because you might see that on another team. You might see a catcher, you might see the umpire. Just be aware of the fact that, you need to stay hydrated during that hot weather. Yeah. So last thing I'll touch on is lightning. I think we probably all know that. If you see that, you hear it, and you need to figure out how to end your practice and go to a safe place, because we just shouldn't be on the field at all if you got lightning. So make sure that you pay attention to that. Good thing we don't have too much of that around here, but we do have some. So I now am going to turn DJ loose on his slides, so he can. DJ has been the safety officer. I think you told me, DJ, for 2 years already. Maybe this is the third year.
Yeah, so I've been in the league for 6 years, mostly as a coach from the time my son was sluggers. Of course, I have twins, and so I have a softballer and a baseballer, boy and a girl, that have been up through the league. So they're out of the league this year, but for the last 2 years, I was the safety officer. And I work as a physician assistant in downtown Bellevue at one of the local emergency departments. So I just plan on talking through some of the first aid considerations. I'll try to keep it very centric on what I think coaches really need to know and kind of what to look out for. So I'll try to keep it as brief as possible. Let me just share my screen here, and then we'll get going. Okay, so Richard, can you see my screen?
Yes.
Okay, perfect. All right, so first order of business, everyone should have received a a standard first aid kit from North Lake Little League. Within that first aid kit, there are a couple of things that you'll probably burn through at a pretty good rate. One of that is the ice packs, right? The commercial ice packs. There's 3 in each kit. I would expect that you'll burn through these fairly quickly. They are also located, you'll see within each of the storage sheds at each of the major fields that we play on. So at Forsgren, at Bastyr and Moorlands, you're going to see cases within those storage sheds as well with kind of resupply. So just go ahead and feel free to just replenish those ice packs as you need to. That's probably far and away the most common thing that you're going to be using out of that first aid kit across kind of all ages. The other things that you'll see in there, there's kind of 2 Ziploc bags that are kind of your bandages, right? There's kind of a minor one that's just filled with some saline. It has some Band-Aids in it as well. Particularly for the younger age groups, we have a lot of nasal explorers. And so you're going to see a ton of nosebleeds. You just will. And so we have these kind of cotton rolled gauze that you can stuff up kids' noses to be able to control that bleed. So you're not having to, spend, 5 or 10 minutes just putting direct pressure on there. And so those are available to you. Sometimes for the younger kids, you have to cut them a little bit. So there's some trauma shears. These things are pretty tough. They'll cut through like pennies. And so you can just kind of trim those things to size to be able to stuff them up the kids' noses until the bleeding stops. So you're going to see a fair amount of that. There's kind of an assorted amount of Band-Aids or some antibiotic ointment kind of in the smaller kit. And so I would expect that you'll burn through. You have a ton of Band-Aids in here. I don't think that you'll go through all of them, but if you run out of any of your first aid supplies, just hit up Richard and he'll be able to kind of, meet you somewhere and kind of refill it. There's another Ziploc bag that has some rolled gauze in it, some larger gauze pads. This is really for kind of bigger bleeding that you may see, something that you might have to put some direct pressure on and maybe put a pressure bandage on. But you have that, you probably won't need kind of that one. You're probably going to be using more of the Band-Aids and the saline, and there's some larger gauze that you can put in that. So most of your wounds that you're going to see, your abrasions, you can kind of manage out of this bag. Kind of the bigger bleeders that, a big gash, a big cut, which I wouldn't expect you're going to see a ton of. You'd want to use the bigger bleeding pack. There's a couple of things in your kit that are nice for putting bandages on and securing them. One is you'll have this Coban, which is kind of self-adherent wrap. If you ever get your blood drawn at like the hospital or at a lab, that's kind of the material that they use. It's a little temperature sensitive, so try to keep it in the original package because it tends to kind of wad up and it just becomes unusable if it gets too weatherized. So just kind of protect that as best you can. Again, if it gets damaged or you run out of it, just hit us up and we'll get you resupply in there. You do have some athletic tape, which I find incredibly helpful to have in your bags, even if it's for just kind of doing some taping up your lineup or something like that, or writing some notes down. But it is athletic tape, so you have that. In terms of other little things that you have in your first aid kit, if you look in the zipper pouches, you'll see that you have a pen light, so you can actually see if a kid gets hit with his teeth. It can be pretty hard to see that, so it's just a little flashlight that's in there. There's some tweezers that are in there, and then there's some tongue depressors in there as well. So if a kid gets hit in the mouth and you're kind of worried about, did they crack a tooth or something like that, you can kind of open it up and move their tongue out of the way so you can be able to see that. There are some gloves that are in there. So particularly with those nosebleeds, you want to make sure that you're kind of protecting yourself. So any kind of open wound, any bleeding, you do have like 3 sets of gloves that are in your kit. If you run out, just let us know. And then the other couple of things that are in there, there's kind of an ACE wrap, which is pretty handy for wrapping on ice packs. So you can just kind of wrap it on a knee or wrap it on an ankle or wrist or something like that. So those are pretty handy. And then there's like some triangle dressing. So if a kid, for instance, we had a player a couple years ago, a kind of a collision between a first baseman and a pitcher on a pop fly. Kid broke his collarbone, and so he couldn't move his shoulder. And so use these triangle bandages to fabricate a sling. So that's kind of why they're in the kit. So those are your first aid kits. Again, if you run out of anything, just send Richard an email, and I'm sure we can get you resupplied, throughout the season if needed. So I'm just going to talk through a couple of first aid topics really quickly. So these are kind of the high level kind of bullet points of things that I'm going to cover, but we'll just go through each of these in turn. And then for the upper divisions of baseball, also talk a little bit about arm safety, which is kind of one of my soapbox issues as a baseball coach and a medical provider. So far and away, the vast majority of things that you're going to see are just kind of minor sports related injuries. So kids getting hit with a baseball, whether it's a thrown ball or a hit ball, you're going to see a ton of that. You may see some twisted ankles, some ankle sprains from sliding into a base, maybe too late, or stepping in a hole or a trip or something like that. So you'll see that. You'll see some kind of muscular strain, so hamstring strains or calf strains, or some shoulder injuries and those sorts of things. So when a kid gets injured, one of the things that you first want to do is fortunately we have two of everything, so you can kind of compare side by side. And do they have an obvious deformity? Obviously, if you see an obvious visible deformity, that raises your concern that it may be a fracture. And so that's something that we want to try to immobilize and protect and not manipulate and not move around a whole lot if you see something that's obviously deformed. Kids are going to get a lot of injuries. They're going to be, tearful and kind of guarded. Often what I've had to do as a baseball coach and a medical person is I just, if it's not obviously deformed, I just get them to kind of move it in all the directions that they tend to move things, right? And just kind of give them that reassurance that they can actually mobilize the joint. If it's a lower extremity injury, kind of the first thing that I try to do after, kind of the first 15 or 30 seconds of tearfulness is I try to get them up and get them standing and make sure that they can bear weight. So people that actually break things, they break their ankle, or they have a significant injury to their knee, they tend not to be able to stand up on their own power and put weight on their lower extremities. And so if they can't do that, then just treat it like a fracture and protect it and immobilize and get that kid carted off the field. The other thing that you can do is you can kind of identify where they actually hurt and try to push on the bony part and see if that elicits any pain at all. Broken bones tend to be painful when you push on the bony bits. Then you just want to make sure they can feel things in their fingertips or in their toes, depending on what they've injured. So just a little bit of light touch and make sure that they can feel things. And it's super reassuring if they can completely move it, they can weight bear it, they don't really have any weakness. There's no bony pain, there's no numbness. Those are usually minor injuries and they don't need like an x-ray like straight away or anything like that. And so it's often just, rest and reassurance, give them a little bit of time off, take them out of the lineup for half an inning, and then just kind of use your judgment, right? So in terms of muscle issues, strains and sprains, kind of the hallmark of care, you guys have probably all gone through this yourselves, is, kind of parents and athletes and just being active people, you want to try to rest those things. Ice is always your friend, trying to ice things for 15 or 20 minutes at a time, try to protect it, elevation. If something is swollen, then you can always use those ACE wraps. So if you see a sprained ankle or a sprained wrist or something like that, you can use those ACE wraps along with the ice to try to help contain some of the swelling. So a fracture is a broken bone. So the more common things that you'll see in baseball are finger and hand injuries from catching a baseball or getting hit in the hand with a baseball. You'll see some wrist injuries, particularly with sliding injuries. That's one of the reasons that they don't allow head first slides in Little League, as they kind of worry about outstretched hands and kind of spraining or breaking wrists. So if a kid takes a tumble and they have an outstretched hand, or if they're sliding and they have their hand awkwardly positioned, they could potentially break their wrist. You do sometimes see that in baseball and softball. You'll see plenty of ankle sprains, hopefully not a fracture that's associated with that, but that can happen. And then, as I mentioned, kind of collisions between two players going after a fly ball. Often what gets broken is the clavicle, the collarbone. from that collision. So if you have a fracture, just protect it, immobilize it, and they're probably going to have to go with a parent and go get an X-ray and urgent care, and then just kind of fill out one of those safety forms for Richard. A dislocation means the joint is out of position. So kind of the more common things would be finger dislocations from just getting it, twisted in an awkward direction. That could potentially happen. Shoulder dislocations are also really common just overall in terms of joint dislocations. Not super common in baseball. It really needs to be kind of an outstretched hand and kind of away from your body. So you're not likely going to see that. If you do, they won't want to move their shoulder and just put them in a sling and they can go get an X-ray. The other joints are pretty uncommon to dislocate, so I don't even think it's worth kind of talking about that. I'm going to skip through that, talk a little bit about, the abrasions and kind of the minor lacerations that you may see. So just try to clean it, with water that's safe enough to safe enough to drink. So you should have plenty of water that's in your dugout with water bottles and whatnot. And that is tap water that's safe enough to drink, is safe enough to clean out a wound. If you have access to soap, that would be great, but most people don't have soap in a dugout. But if you have if you're playing at a field that has a restroom that has some soap, that would be ideal. There is some normal saline, which is sterile kind of solution, saltwater solution. You can use that to kind of wash out wounds as well. And then there is some topical antibiotic in the kits and little self-contained kind of single dose packs in there as well. If you have deeper lacerations that are actively bleeding, just put some direct pressure with a gloved hand on it, some sterile gauze, and that's where, using these ACE wraps or maybe even this Coban kind of elastic bandage and kind of wrapping it not too tight to where they can't feel things and they're not getting blood down to their fingertips, but enough to be able to kind of maintain that direct pressure on the wound so it stops the bleeding. I haven't seen it too much, but you will potentially see some bee stings or hornet or wasp stings, as a coach. So if there's a stinger that's present, one of the first aid tricks is to kind of pull out a credit card and kind of remove the stinger by, grazing it across the skin, kind of wash out the wound, kind of treat it like any other wound, puncture wound, and then put some ice to just control the swelling, help a little bit with the pain. Bee stings in particular have a high susceptibility for severe allergic reactions. So just kind of watch for that. And hopefully they annotated that on some of their medical information forms for you guys. So you're aware that you have a bee sting allergy. A lot of people with bee sting allergies will have an EpiPen that's maybe in their equipment. And so just kind of watch for that. So if a kid ends up having like a diffuse rash or they have kind of any lip swelling or difficulty breathing, that's kind of signs of a more severe allergic reaction. So just kind of watch that when kids get bit by a sting. Concussions. Now, this is not an uncommon injury that you're going to see in baseball and softball, particularly in the older ages, right? It can happen with bat safety issues in terms of controlling the bat. It happens a lot of times on infield at collisions at bases. It also can happen from a catcher taking a foul ball into a catcher's mask. So kind of lots of opportunities for that, hit by a pitch with a helmet. Fortunately, the kids are wearing a good amount of protective gear when they're in the most vulnerable places, when they're base runners and when they're in the batter's box and in the catcher's position. And so that helps mitigate things a lot, but nothing's 100%. We take traumatic brain injuries or concussions pretty seriously in Washington State. We'll talk a little bit about a specific law, and that's why there's a concussion information form that's we make every parent sign, because it's essentially it's a big deal if a kid has a concussion and then they take a second insult, they get another bump on the brain, and so there's kind of a rare phenomenon called secondary impact syndrome that can lead to sudden death with traumatic brain injury. So we want to make sure that we're not putting kids' brains who are like on the developmental trajectory there. So it's just not worth it. So you're going to see lots of mechanisms, and sometimes you just have to kind of, visually kind of watch like how violent these collisions are, kind of what the mechanism is. Concussions can happen either when a kid gets knocked out or a kid gets stunned, or they could look completely normal. They just might be dazed and, confused just for a couple of seconds. One good thing to ask about as you're kind of doing your assessment is just kind of ask them about the situation, right? Like, hey, just what happened? Tell me what, your batters count is, or, see if they can recall the last play and see if they have that ability to actively recall. So if there's any degree of kind of delayed thought processing or confusion or uncertainty, it's probably worth sitting that player down and having them not return to the game. And then if they develop any concussion symptoms over the course of the next kind of several minutes, right? So if they start developing a headache, they start feeling a little nauseous, start feeling a little uncoordinated, a little clumsy, slow to answer questions, any kind of repetitive speech, anything like that, difficulty with their balance, you should just pull them, sit them down, don't let them get back into the game. And just have them checked out by their pediatrician, and they shouldn't really kind of return to full baseball or softball activities until they're cleared by their pediatrician or medical provider. So I think I basically just kind of talked through that. This is the law that's within Washington State. It's called the Zachary Lystedt law, and it was kind of a teenage football player in Washington State who kind of had a concussion, kind of went back into the game, and then he ended up with a severe cognitive disability as a result of the second impact. And so Washington State has created a law which includes that parent acknowledgement that everybody signs. So just make sure that you're collecting that up. We want to talk about the significance of head injuries to all the coaches and make sure that you're aware. And if there's any degree of suspicion, this is Little League, it is rec baseball, these kids, we do not need to be risking any kind of further injury to their brain. So just pull them. There's not a recreational baseball or softball game that's kind of worth any of these risks. So just make sure that they're cleared. Eye injuries, I haven't seen these a lot. They are kind of talked about a lot, and baseball and softball are kind of the classic mechanism for what's called an orbital rim fracture. And so somebody takes a softball right to the cheek and kind of breaks the bone of their cheek or of their upper orbit. I would say that that's fairly uncommon. It may be a little bit more common for a kid to get a scratch and like an abrasion and a lot of eye pain and just irritation to the eye. But if somebody does take a ball that's hit to the face, whether it's a line drive or a pitch ball, and they do take it right on the rim, that's a potentially significant injury, and they may want to have that checked out, particularly if they're complaining of any kind of double vision. You want to make sure that they're taking a look at it. So just if you see that injury, kind of see where they got hit, see where the swelling is, see where the bruising is, maybe push on that bony prominence and see if they're tender. You want to make sure you look at the eye. There's a little picture here of bleeding in what we call the anterior chamber, kind of the front of the lens of the eye. If you see that, that's a big deal. That's dangerous. So if you see like a fluid level in front of the iris of the eye, they need to go to an emergency department. And just one of the things that we'll do is just kind of have them move their eyes side to side, up and down, and just make sure that their eyes are moving clearly when they have one of these types of injuries. Nosebleeds, you're going to see them. You're going to see it in like all levels. I think the younger levels, I feel like as a sluggers and a AAA baseball coach, I was dealing with this like on the daily in baseball games, right? And so, what you want to do is you want to kind of have them lean forward, pinch just, you've got the nasal bone right here. You want to pinch just below that nasal bone and just kind of lean forward. You don't want them to swallow the blood because it'll just make them sick and then they'll vomit. Then you'll have blood plus vomit in your dugout. So just have them, the player kind of lean forward, pinch their nose, get your gloves, right? And then you can grab some of those, kind of those nasal tampons, so to speak, and plug their nose. Most bleeding, I mean, these kids aren't on like blood thinners or anything like that, so they should be able to control that nosebleed usually within 5 minutes, 10, 15 on the long side, and then just kind of clean up the mess afterwards. If you can't get them to stop their bleeding after 10 minutes or something like that, then just kind of remove that gauze and try again. The bleeding's going to stop eventually. Dental injuries, I haven't seen a whole lot of, but kids can take it in the grill, so they can get a a chipped tooth from a baseball or a softball or something like that. They may have pain. It may be temperature sensitive. They may have a hypermobile tooth, right? They can wiggle it. Of course, at a lot of these ages, they're kind of losing their teeth constantly, so they always have wiggly teeth. If they lose their primary teeth, due to an injury, we don't reimplant the primary teeth. If it's the permanent teeth, really kind of the thing to do is to not touch the root of it. Don't scrub the tooth. Don't try to clean it off. You can rinse it with water that's safe enough to drink. You can make one attempt to try to reimplant it back in the socket, but then they should go to an urgent care or an emergency department to get it looked at, see if they can splint it for them, or to a dentist. I don't think I'll talk about this one too much. It's not really a fairly common event. So, what should you do as coaches when somebody gets injured? The umpire is responsible for stopping play, right? And so you have to wait until the umpire, the game is going to be going on. So don't go charging the field. It's, the umpire is controlling the flow of the game. So once kind of the play stops, then the umpire should stop the field, and just make sure everything is safe. It's pretty common, particularly at the younger ages, for all the players to just kind of drop to a knee, and then a coach or a designated first responder, safety officer can go out there and kind of take control of the situation while the other coaches are kind of keeping the kids clear from kind of the injury. So anyone that's really not needed to be involved in injury can kind of keep a safe distance, right? And then, if there's, two players that are injured in a collision, you may have to kind of prioritize which kid is looked at first, or you may need a second coach to kind of take a look at the other kid. And so, just make sure that you kind of have other people that are kind of controlling the scene, other coaches and the umpire. And then you can, the responder can really focus on the player that's injured and really do a good focal direct assessment and kind of make some good treatment decisions about that. So I would say that the first priority, if there's a significant violent collision and there's like trauma to the head that's related to that, think about protecting the neck and the head from any particular movement. Just make sure that they're breathing okay, that they're able to, they have an open airway, that there's no bleeding. Try to lean them forward if they have any bleeding, or if they're nauseous or anything like that. Get them in a position that they can breathe pretty easily. And then, if there's any bleeding that you see there, just, put some direct pressure on there with some gauze or, a gloved hand. And then if you're really worried about how violent the event was, you can call 911 immediately and the EMTs will show up. Clear things that you should call 911 for: head trauma with a loss of consciousness, or any confusion, or if a kid starts vomiting after head trauma, that would be a big deal. If a kid has trauma to the neck and he is having difficulty breathing, can't feel things, can't move things, kind of those eye trauma injuries that we talked about a bit ago. Any fracture where you see kind of breaks in the skin and exposed bone, that would be a good reason to call 911. And then any medical emergencies. We kind of talk a lot about traumatic injuries and collisions and those sorts of things, but kids have seizures, right? There are kids with epilepsy, there are kids with severe allergic reactions, there are kids with severe breathing difficulties because of asthma exacerbations. And so if you see any of those types of things, feel free to call 911 as well. And if there's any question of whether it's an emergency or not, that's what they're there for. And around most of our baseball fields, you're going to get an EMT crew there probably within 5 minutes or so to most fields. So, more commonly, it's going to be a less severe injury than that. So I usually ask them, hey, would you injure? What hurts? Try to expose the area that got injured down to skin level, just to make sure there's no bleeding, no bruising, no swelling. And then, just apply the best first aid that you know how to give, right? So, kind of, we talked a lot about those, fracture assessments, kind of sprains and strains, and can they weight bear? Can they move things? Can they feel things? Those are kind of good first steps for all of those things. And just kind of make your own decisions about whether you feel over your head or you feel like you need some support. And I think parents will often kind of help you make those decisions too. If they're being transported by EMS and no parent is present, then make sure as a coach you're contacting the parent. That's the reason that you have to have those emergency medical information forms on it. It has, kind of all their medical information. That form should go with a child that's transported by ambulance. It would be a good idea to send another adult, whether it's another parent or one of your coaches, to ride along with the kid if you do send them. But I find that most times there's a family member or parent that's there. These are the closest hospitals to our North Lake Field. So downtown, in Kirkland, just off of 405, Evergreen Hospital. A lot of families will elect to send their kids kind of south towards Seattle Children's because it's a pediatric specialty center. And then there's also, when you're playing the North Bothell teams kind of up north, there's a Swedish ER at Mill Creek. And so those would probably be the more common things. If you have any questions about a significant injury, particularly if you send a kid to be assessed by an urgent care or an emergency department, you'll want to fill out one of these incident reporting forms. You should always have like one hard copy of that form kind of in your coaches or managers binder or folder or clipboard or whatever you use to kind of carry your team forms in, and just kind of fill that out. Try to turn it in within 24 hours of the incident, and just send it to Richard. If you don't send it to Richard, then send it to Andy Pearson and he'll make sure that Richard gets it. We just keep it on a local file. It's part of the safety plan that we kind of keep track of the types of injuries that we're seeing. I think I became the safety officer because I was like the one coach that had to fill out one of these forms when I had a player, take a baseball to the face during like a throwing drill when they looked the other way and the kid didn't realize he wasn't looking. And I had to send a kid for a broken nose to the ER. So I think my penance is that I was the safety officer for 2 years. So that's kind of the nuts and bolts of the typical first aid training for most levels. So I'm just going to spend just a few minutes kind of talking about arm injuries, particularly for the pitching divisions of baseball. So this would be AAA through majors or juniors. So I'm just going to talk a little bit about arm injuries because it's a bit of a plague in baseball. I feel like maybe over the last couple of years, it's getting a little bit better as the education gets out there and kind of the pitch smart rules are in effect. But it almost seems like a rite of passage for a lot of baseball pitchers that are in their late teens and early 20s that they're ending up getting Tommy John surgeries. And so we just kind of want to talk a little bit about, what puts kids at risks. And we'll talk a little bit about how we want to mitigate some of those risks. So the reasons that young baseball players get significant arm injuries, particularly we're talking about elbow injuries in particular, are some of these things that you see on the screen here. So they're pitching on consecutive days. That's one of the reasons that we have kind of the consecutive day rule that's in place for Little League. Pitchers, particularly ones that play on multiple teams. And there are a number of players, particularly older players, that are playing Little League baseball, but they may be on a travel team or they may be on a select team. And so they may be playing on 2 different seasons or 2 different teams at the same time. And they may be pitchers on those teams, or they may be catchers on those teams. And so those arms are seeing a lot of use. And so, you want to kind of take stock in the players that are that you have on your teams that are in other programs as well, and just kind of making sure that you're communicating with the parents, communicating with the kid, how much throwing that they're actually doing. We don't see this a lot in Little League baseball, but tournaments and club teams that play multiple games on the same day, and you're pitching in multiple games in the same day, or the kids that are playing competitive baseball for more than 8 months out of the year. Pitching when they're tired, so not adequate rest, or their arm is feeling like it's not rested. Too many cumulative innings over the course of the year, pitching on consecutive days, a lot of throwing when they're not pitching, and those sorts of things. Pitching when they have other injuries that they're dealing with. Those are all kinds of risk factors for developing significant arm injuries going on. Went the wrong way. So the thing that you really want to pay attention to, and unfortunately we've seen this in couple of kids every single year, particularly some of the pitchers that see a lot more use, is called Little League elbow. It's an overuse injury most commonly seen between the ages of 8 and 15. It's actually a stress to the growth plate as their bones continue to grow. So the growth plate's kind of the spongy part of bone that isn't fully fused. And so it allows the bone to continue to grow so they can get taller and their arms can get longer. And so it's kind of a vulnerable space, and kids with growing bones and growth plates to, as you're throwing a lot, you put a lot of stress on something that's not hard structure. And kind of pitchers in particular are susceptible to kind of this repetitive stress. And so it tends to be not something that's like a sudden pop or a sudden tear that they feel. It's more kind of a gradual pain that they're starting to get kind of on the outside part of their elbow. If you kind of rotate your forearm around, you'll kind of feel that ligament kind of rotating or that bone rotating within the elbow. There's a ligament attachment there. And so when they have kind of pain on that part of the elbow, then you want to start thinking about that. It's more common in the latter parts of the season. So when you start getting to late May and late June, they may have that. There is an occasion where, it tears, and that's the popping sensation. And that's kind of the arm just goes limp and dead, and they can't move their arm, and it'd be sharp pain, and they don't want to kind of rotate their arm and extend their arm. And so if you have that, that's a significant injury, and they're quite honestly probably done for the season. So kind of the ways to prevent these things, first and foremost is just kind of, good all around year-round fitness. They try to encourage young players to have what we call active rest. So you're playing other sports, you're engaged in other activities, non-throwing sports for 3 to 6 months out of every year. And then very, very importantly is strict adherence to pitching guidelines. And so that's why we have coaches fill out pitching reports and adhere to the number of rest days. And particularly for minors in majors baseball, last year we had so many kids that were playing in select ball and kind of pitching for other teams, and had a concurrent Seattle Elite system that we put it on OneDrive last year, and we could have good visibility of people's when they're pitching, how much rest they're getting, what their total pitch counts were throughout, different portions of the season, and be able to kind of use that to gauge kind of the way that we're managing our own pitchers, which I think was a really good idea and very effective. So make sure you're paying attention to those pitching guidelines, make sure that warm-ups, that they're not throwing as hard as they can during their warm-ups. You want to make sure that their arms are really getting loose, kind of focus on pitchers training and good throwing mechanics. And really just being kind of perfect in the way that they're, doing their pitching mechanics. Focus on control, not velocity, right? I think at this age, kind of command is much more important than how hard that kids are throwing. So teach them that throwing strikes is what matters, not throwing hard. And then, there's kind of a general rule that kids should not be throwing curveballs until age 14. They shouldn't be throwing sliders until age 16. You're going to see a lot of kids at 12 and 13 that start kind of experimenting with these breaking balls, but these are kind of sports medicine recommendations. There are safe ways to throw curveballs, not really safe ways to throw sliders on kids' elbows. But you want to make sure that they have a good pitching coach and are doing it the right way so they don't injure themselves. They should not throw for the first 1 to 2 days after a significant pitching outing. So if they, throw 50 or 65 pitches, you want to make sure that they have if you have practice the next day, you want to kind of give them kind of a light or no throwing day the day after, or the practice after, maybe even for a couple of days. And just really try to assert to them to avoid maximal effort throws. And, one of the things that we would often do is just, at the start of practice, kind of do a check-in as we start talking about the practice day, and just make sure that, hey, does anyone have any arm pain anywhere, any shoulder pain, any elbow pain? Just doing a check-in with them, and just make it part of our warm-up routine to have that conversation as well. There is a new district rule in District 8 in terms of pitch counts that the majors managers and minors managers need to be aware of, that there's a 50 pitch limit to every pitcher prior to May 1st. And so I think this was originally a North Bothell rule. We ran into this last year with North Bothell, that was one of their local rules, but it is now a District 8 rule. So just make sure that you're in compliance with that rule too. Particularly when you're doing interleague play. If you do have a kid that starts complaining of elbow pain, just shut them down, give them complete rest, have them ice where they have pain and swelling. You can, let mom and dad know that anti-inflammatories like ibuprofen are good medicines to use for things like that. I often have kids, particular kids that are kind of older pitchers, to think about seeing their pediatrician or maybe even a sports medicine person and kind of get a formal evaluation before they return to pitching. Sometimes they'll give them some throwing exercises. We've had a number of kids that have actually gone through formal rehab programs for Little League elbow within the league over the last few years. And they shouldn't return to pitching until they're pain-free. They can fully move their elbow. They've got normal strength in their elbow. When a kid's returning from an elbow injury in particular, put them in non-throwing positions initially at like first base or second base, something that's pretty light on their arms, as opposed to outfield positions or, kind of the left side of the infield. And then, if the kid's really, really having a lot of pain and, just not getting better, then that's oftentimes where I try to nudge mom and dad into getting a formal assessment and see if they need a formal kind of return to throwing, full throwing kind of activity that's structured from a sports medicine provider. So that's kind of the first aid training in a nutshell. I'm going to turn it back over to Richard to close everything out. So Richard, it's all yours.
Thank you. Thank you, DJ. Hey, that was great. I was wondering if you can answer a question quickly about that arm injury. If you see that in catchers, because they're throwing maybe more than the pitcher, but they're not throwing differently, obviously. But I wonder if that's how much you see that, and are there any things we should be aware of to look for in catchers?
Yeah, so there are specific rules in terms of how many innings a player can catch and be prevented from being a pitcher within that game. I think it's a max of 3 innings at the catcher position, and then they can't pitch for the game. And then there's a specific pitching threshold. I think it's either 35 or 40 pitches that if a pitcher exceeds that, then they can't go to the catcher position. As they get older in baseball, in Little League, you're going to see a lot of kids that play both positions, right? They tend to be a very reliable player, and so they tend to be in those positions fairly commonly. So it is actually a pretty difficult management issue for kind of the baseball divisions. But the older that you get in baseball, by the time that you're 14, they tend to diverge, right? Like kids that are primary catchers are just not pitchers, and kids that pitch are not catchers. And it's really kind of the arm overuse injuries that you just can't do both, particularly when you're throwing hard and throwing higher pitch counts. And so just kind of know that as a coach that, the total volume of throwing that kids are doing, and those are the 2 positions that they'll throw more than any other position on the baseball field. You just have to be mindful of that. And then be mindful of the rest as well. So, kind of those players that their arms are getting a lot of use, you want to make sure that you're, protecting them in practice, and they're not kind of, throwing long toss or doing outfield drills, when they're on short rest.
Yeah, I guess we've got a little bit of an advantage in softball pitchers because they're doing a totally different motion, but I'm sure there's some hidden injuries there that we maybe don't pick up all the time now. I don't know, because some of these girls throw a lot, right? I mean, when you see some of these older leagues, they're throwing one pitcher most of the time.
Yeah. That's it was shocking as a baseball guy to watch that in softball, how like pitchers will pitch multiple games within, it seems like it's no concern for pitch counts, right? Different throwing mechanics, different stress on the arm.
All right, thank you. Anybody else have any questions? Sorry to hog the time there. All right, well, I really appreciate everybody listening. I am recording this, and so I hope I can figure out how to make that recording available to everybody. But yeah, so I'm still recording, and as soon as we end this, we'll stop it and send it out. And I'll work with DJ to see about those slides, because it's a big file, and so it's hard to share. But there might be a way that we can put a link to that. But we'll work on that, and in case somebody doesn't have time to listen to the whole thing, but they want to look at a particular part of the slides. Okay. All right, everybody. Thank you very much. And everybody have a nice evening and a great season. Looking forward to meeting some of you. Yeah. Thank you. Thanks, DJ.